today we are going to run through some hip treatment techniques. The first one I'm going to start with is a long axis distraction manipulation. So for this, you want to get the hip in its open pack position, so you're going to go a little bit of flexion, external rotation, and some abduction. You can do this two ways. The first is to cup around the ankle, lean back until you've taken up that slack, and then the hip. I also like to sometimes use a towel around the ankle just for patient comfort. Wrap that around the ankle, grab on, and then you can do the same thing, get in that open pack position, take up the slack, the nip. Next, we are going to do some lateral glides. I prefer to use a belt with this, but you can use your hands as well. For hands, you want to bring the patient up into a little bit of flexion for either of them, honestly. Interlock your fingers so you have a good stable base to mobilize from. You're going to go into the hip crease, kind of use your shoulder to help block the femur, and then you can perform that lateral glide. Or with a belt, you can ask the patient to place the pad of the belt into their hip crease. If I had a high-low, that would be more ideal. That would be more ideal because this is a little low for me for this mobilization, but you'll clip in your belt. Use your hand to stabilize the femur at the knee, and then you can just sit back into that belt to get that lateral glide or distraction of the hip. Next, we are going to do the supine long axis version of an A to P for the hip joint. So you'll have your patient in this long axis, just leg extended. You can internally and externally rotate to find the greater trochanter, that way you know you're going to be in the right spot. Take the heel of your hand, go right above that, and then sink in for that A to P. I like to tell patients for this one that you should feel a stretch in your back pocket. An alternate way that I like to do this at times, if this isn't working well for the patient but you still want to get the A to P, is to have the patient cross their leg over. You can make a little cup shape so that you're not compressing on their patella, and you can just mobilize straight into that back pocket by pushing at that diagonal there. We'll go ahead and do our contract relax techniques while I have my patient in supine. So with the leg extended, the piriformis is an external rotator. So anywhere from neutral to up to like 60 to 90 degrees of hip flexion. To do a contract relax for the piriformis, you will want to internally rotate the leg and then ask the patient to push against you. And then when they relax, you should ideally be able to internally rotate them farther if the piriformis is the problem. And you can do that same thing with the hip above 90, but then the piriformis is an internal rotator, so you're going to want to externally rotate the hip, then have the patient push against you, back to neutral, and then when they relax, you should be able to rotate them more. Same stretch. Last thing we will do is the piriformis tendon stretch. So I'll have my patient come over into prone. You can find the piriformis by locating the greater trochanter, finding the sacrum, and you know that it lies there. For this one, I would usually like to use my elbow, but just so that you can see, I will use the heel of my hand. So you know the piriformis should be right here. You're going to apply pressure, and then you can externally and internally rotate their leg as you're holding pressure on that piriformis. I like to get my elbow in there and bring them into as much external as I can, and then back off of that.